So Albanese's found $8.5 billion under the mattress and is promising in 5 years' time, 9 out of 10 trips to the doctor will be covered by one of these. Sounds good, right? So good that almost immediately after it was announced, Peter Dutton decided, well, he's going to do it too. You heard that right, even Dutton wants to support universal healthcare. Welcome, Conrad. 2 major parties planning for an election that hasn't even been announced yet. A Labour government that would like to believe it's known for healthcare reform, and an opposition led by a man who was once voted by Australian doctors as the worst health minister in living memory. And yet apparently they all agree that this is going to happen. So what's actually going on? Well, Albo's accusing Dutton of making up policy on the run. Labour's plan is aiming for 18 million bulk billed GP visits each year and tripling bulk billed practices to around 4,800 nationally. To round it out, there's also going to be hundreds of nursing scholarships and thousands of doctors and the largest GP training program ever. But with Peter Dutton saying, anything you can do, I can do better, where does he think the money's going to come from? Well, he's going to slash the public service. This copy-pasting of politics isn't anything new though, and it's not even the first time we've seen it this year. In Queensland, the Libs are committing to match Labor's $7.2 billion for the Bruce Highway. So, can they just do this? Well, of course, but it's up to you if you believe they're going to follow through.
They said before 2013, remember they got elected, Tony Abbott famously, no cuts to health, no cuts to education, first budget, $80 billion, 50 off hospitals, 30 off education.
Politics aside, what do the doctors think? Well, both the Royal College of GPs and the Australian Medical Association are welcoming the investment in what they say is a chronically underfunded service, but want to see more targeted funding from both sides for the treatment of more complex and chronic illnesses.